Hello, and thank you for joining us for Methodist Healthcare's Breast Cancer Series. This series will provide you with the tools to empower you to take control of your breast health. And today we're joined by Dr. Ramon Garza, who is a breast reconstructive surgeon, and we'll be discussing lymphedema and treatment options. Dr. Garza, thank you so much for being here with us.
Thank you for having me.
Definitely. Could you tell us what lymphedema is and how it's treated?
Sure. Lymphedema is the abnormal swelling of an extremity. In breast cancer patients, it's the upper extremity or arm. And when that happens, it's a result from surgical treatment of breast cancer. The breast surgeon's goal is to remove as many lymph nodes as possible to cure you of your breast cancer. So when the breast is removed, sometimes lymph nodes are also removed from the armpit, and that can lead to a situation where fluid accumulates in the arm, and that scenario is lymphedema.
What exactly is the lymphatic system?
The lymphatic system is a system that functions in two ways. It helps with management of fluid, so veins and arteries transfer blood. The lymphatic system helps transfer the fluid that is accumulated around the cells. The second very important function is an immune function, so it helps detect when an abnormal foreign body is in our system, such as a bacteria. For example, if you have a cut on your hand, you have white blood cells that'll come and take the bacteria that has entered your wound, and it transfers it via the lymphatic channels to the area of the armpit where the lymph nodes are, and it presents it to the lymph node and says, hey, I caught this thing, that's a bacteria, is this bad? And they say, yes, that's something that we should mount an immune response against, and then that's when the whole immune system gets kicked off and you can start fighting the bacteria.
Okay, and what are the risk factors of developing lymphedema?
So it's a great question. When 10 or more lymph nodes are removed from the armpit area, if radiation is involved, chemotherapy, or a BMI, a body mass index, higher than 30 are all risk factors for developing lymphedema.
Okay, very interesting. Could you tell us, can lymphedema be cured?
No, unfortunately it cannot be cured, but we can manage the symptoms. Most patients who undergo treatment report a significant increase in quality of life and a reduction in the symptoms they're having. So for patients that are at risk for developing lymphedema, it's important that they be referred to see a lymphedema therapist. These therapists can help prevent the onset of symptoms and teach the patients exercises. Skin care is very important. Sometimes weight management is very important, so getting to that lower BMI of less than 30 is very important for these patients, and this can help prevent lymphedema from even coming on. In addition, we also evaluate patients for lymphedema to see if they're a candidate for a surgical option. The other treatment involves taking lymph nodes from another part of the body and transferring them to the armpit to replace the lymph nodes that have been removed.
That's all very interesting information. Thank you so much for being here.
Oh, thank you.
And remember, early detection saves lives. We challenge you to schedule your annual screening. Just go to makeyourmammo.com to schedule your mammogram today.